Hi, Namaste and a very warm welcome to the Skin Doctor channel. I'm Dr. Sujith Kumar, your dermatologist. A few days back, a young man walked into my clinic with swelling and redness on his lips. The moment he walked into my clinic, I had a diagnosis in my mind, and that was Stevens-Johnson syndrome. The first question I asked him was, did you take any medications before this happened? And he said no. But when I examined him, he couldn't open his mouth. His entire mouth was swollen. The skin on the lips had peeled off. The lining of the mouth had peeled off, and he couldn't open his mouth properly. He couldn't even eat solid food for the last 3 days. And on further questioning, he said he had pain and discomfort in the penis too. And when I examined that area, I found that the urinary outlet, the urethra, had been inflamed. Now I was damn sure that I'm seeing a case of Stevens-Johnson syndrome. After several rounds of questioning, he remembered and agreed that he had taken 1 tablet of paracetamol 4 or 5 days back when he had a headache. With this, I was very sure that I'm seeing a case of Stevens-Johnson syndrome. Paracetamol is a very common drug which people use for headaches and fevers, which is easily available everywhere at a very small price. It is available over the counter at the pharmacy or at the supermarket. Everywhere you can get paracetamol, and paracetamol is a wonder drug. Only a person who had a very severe throbbing headache with which you feel like, ending your life, and then just you pop a pill of paracetamol and the relief you get, only a person with a headache relieved by paracetamol knows the value of the medicine called paracetamol. I'm not blaming paracetamol. Paracetamol is a wonder drug, a wonder medicine, a great invention in the history of medicine, which is a very, very, very useful medicine and with very less side effects compared to so many other medicines. But then what I'm warning you is paracetamol can cause this potentially life-threatening disease or allergy called as Stevens-Johnson syndrome, which may progress to a much severe disease called as toxic epidermal necrolysis or TEN, which can even cause death. Might be 1 in several thousands of people may get an allergy to paracetamol, but then it does cause allergy. There have been several reports of paracetamol causing Stevens-Johnson syndrome, and that's why I said paracetamol can rarely cause Stevens-Johnson syndrome. So we have to keep this in mind. So Stevens-Johnson syndrome is a potentially life-threatening serious drug allergy which may progress to a much fatal kind of allergy called as TEN or toxic epidermal necrolysis, which can even cause death. Now the difference between SJS and TEN, the Stevens-Johnson syndrome and the toxic epidermal necrolysis, is the amount of body surface involved. If the body surface involved is less than 10%, then we call it a Stevens-Johnson syndrome, and anywhere from 10 to 30% we call it as an overlap of SJS and TEN, and if it is more than 30%, that is if 30% or more of the body surface area is involved, then we call it as TEN or toxic epidermal necrolysis. The most common medicines which cause SJS TEN are the anti-epileptic medicines which we give for the fits, drugs like carbamazepine, lamotrigine, phenobarbital. All these can cause Stevens-Johnson syndrome. Even antibiotics like penicillin and sulfonamides can cause Stevens-Johnson syndrome. Painkillers, which we call as the NSAIDs, non-steroidal anti-inflammatory drugs, which we use commonly for the joint pains and body pain and all that, these medicines can cause Stevens-Johnson syndrome. Once the diagnosis of Stevens-Johnson syndrome is made, the patient should get the best care possible, and if it is progressing into TEN, the patient should be admitted and treated with a team of doctors, what we call as a multidisciplinary approach, where doctors from different specialities come together to treat the patient. The patient needs to be seen by an ophthalmologist, by a physician, by a surgeon who is a burn specialist, by a dermatologist. It's a multidisciplinary approach, and the patient needs very, very, very sophisticated and very good care, and in an ICU setup, in an intensive care unit setup, so that we can save the patient. I've seen several cases of TEN when I was doing my post-graduation, and I'd seen how nicely our professors had managed those cases, and it was a real experience seeing those patients, and seeing the suffering of those patients is really, really painful, because we make the patients sleep on banana leaves. I've seen patients being made to sleep on banana leaves by our professors, because anything else will make the skin stick to the fabric or whatever, and it causes a lot of discomfort and problem to the patient. The most common long-term complications of Stevens-Johnson syndrome and TEN could be involvement of the eyes, which may lead to blindness. As I told you, Stevens-Johnson syndrome TEN can be fatal, and people may even lose their lives, and the most common cause of death is usually a severe infection all over the body, which we call as sepsis, and the patient may die because of multi-organ failure or failure of the different organs of the body. There could be severe bleeding in the stomach. There could be some problem in the lungs, which we call as pulmonary embolism. There could be myocardial infarction or heart attack, and various things like this may lead to the death of the patient. So the take-home message for today is that just don't pop a pill when you have a small headache. Don't take a pill unless you really require to take it. Please see a doctor when you have an illness. Always take medications on advice of a doctor, under supervision of a doctor. One more thing I would like to remind you is that patient having allergy to one drug may have a cross reaction to several other drugs which may belong to the same category. People in the same family may be having common drug allergies because of genetic predisposition. A patient having allergy to a certain drug might have family members having allergy to the same drug, so family members also should be careful if someone in the family has a drug allergy. So with this we come to the end of this video. Hope you like this video. If you did like, please give a thumbs up, which really means a lot to me. Please don't forget to subscribe to this channel. Thank you so much for watching. Until I see you next time, namaste, bye, and take care.